Hey everyone, Dr. Morales and Linda.
Hi guys.
Again, doing a weekly topic about plastic surgery, and the topic of this week is what is recovery for a mommy makeover? And so everyone always has a top concern of when can I get back to work, when can I exercise for mommy makeover, and this is probably one of Linda's top questions that she gets, and she kind of starts right off the bat, which is almost always hand in hand comes with what exactly is a mommy makeover and what does it include. And so I'm gonna kind of Linda to talk about that.
Right, and so the patients don't know really, do they need a tummy tuck? Do they need just liposuction? And so we go into that. We ask about the skin. We ask about babies and their age and things of that nature. But mommy makeover, everyone's mommy makeover, and we said this before, it's kind of individually. Everybody's mommy makeover is a little bit different than the other. But the hardest part, they ask, what is the hardest part? What is the most uncomfortable part? And really, it's the tummy tuck. That's what's going to take the most for you to go back to your normal activities and your work, right?
Yeah, absolutely. I mean, the tummy tuck is a longer recovery time for a mommy makeover. So it's going to include breast typically, and then kind of like the abdomen area. Some women need a breast lift. Some it doesn't add to anything to that for recovery wise. Maybe breast and abdomen. A tummy tuck is a bigger recovery. So the tummy tuck, it's a very powerful surgery. So we're addressing several things. We're addressing excess skin. We're addressing extra fatty tissue. We're addressing the tightening of the muscles from having children. So that's kind of the harder part. Is tightening the muscles takes a little bit more recovery from that. And that's where the questions of, well, when can I go back to work? And then Linda's going to ask you,
what do you do for work?
There you go. That's what do you do for work?
That's right.
And so she has this kind of routine, and she goes over that. So I kind of let her do that one.
So if my question is always, well, what do you do for work? Some patients say, desk work, I sit all day. And so for those patients, recovery is about 2 weeks. For our more active patients, like our nurses at hospitals, hairdressers, bartenders, realtors, those type of people that are on their feet all day, kind of running around all day, those people need about 3 weeks.
Yeah. So those women who choose to go back to work in 2 weeks, doable. You're gonna be pretty miserable, and you end up getting sent home. That's what I've heard many times. They try to go back, and they're just miserable, and they get sent home in the morning, late morning. So, and then when it comes that, then this is my thing, right? So it's all about getting back to exercising, and that's what I kind of specialize in.
Yeah.
And that's usually around week 3, week 4, depending on the recovery of each patient. But we're talking about cardio at 3 weeks. We're talking about weight training at 3 weeks. We're talking about other modalities of exercising, like Orange Theory and maybe some CrossFit. I'm pretty fluent in most of these exercise modalities, but I want you moving at 3 weeks. That's kind of the goal, unless there's some kind of issue going on at that time. But the idea is to get you moving, and I think it really promotes your swelling process recovery. I think it makes you feel better, especially mentally. People get a little stir crazy around week 3, so it's a good thing. And then at 2 months, we get you back to pretty much everything as far as exercise and work activity. There was a couple things, if you have a tummy tuck, that I'm going to kind of restrict you from for another couple more months, and we'll talk about that when you get to that point. But that's it, huge question. When I can get what is recovery like for my makeover? And so hope we answered those questions for you. Keep following us. Topic of the week every week.